think I put it on way too early, so I don't know if that's it, but I'm going to try to take as much off as possible before I do the injections. It's a lot more important to get it totally clean if you're microneedling than if you're injecting in, because when you're microneedling, you're putting it all in. But you want to tell your patients to come with clean hair, no hair gel, no hairspray, clean and not knotty hair. If you're working with long hair, you'll see we work with a comb, and we don't want to be having to comb out knots. So I'm trying to clean this as much as possible, but like I said, if you do use local anesthetic, it does make it a lot messier. Yes. Only about 20% of my patients use anesthetic. I often use it the first time. Because the people next to us was just saying, put it on, so we put it on. So, basically the whole concept, and like I said, people always say, oh, I want to see your hair injections, and it's so simple to actually an anticlimax. But the whole concept is that we want a grid of centimeters. So I'm going to make do you mind lying down back? Sorry. Is there anything we can put? Yes, that pillow. Can we just pillow? That's a great idea.
Do we have another cover for the pillow?
Or linen saver. Or I can just stand on my tippy toes as long as your neck's fine like this. No. You stay. So, if I was just doing hair, which I am now, Marvin's done the spin at 300 for 5 minutes. Because I'm not wanting any volume, I'm just wanting the richest possible growth factors to stimulate these hair follicles. Okay, so that's my first, I work a lot with my comb. Okay, so that is, I'm going to show one with just the yellow, and then the fancy one. So we've got this fancy pitchfork 3-gauge needle, and for those of you who just already have the 30-gauge needle, it's a very good place to start. You can lean on it if you want to. So help with that person. Thank you so much. So this is exactly the same needle that you'll have in your office. Okay. We're used to injecting like this, but it's just too much for the scalp. So my hands are on top. Oh, we've got this. Thank you so much. We're going to give you the pillow now. You can leave that. Let's get you. How is that? Okay. So what I do is I just check to see that it's not blocked like that other syringe was blocked before. And I'm going to start right where I want the hair to grow. And then I'm just pressing down with my finger, and it's 1 centimeter apart. Okay. But then as I start to get into it, you can start to go quickly. Is it running down into your eye? Did you know that the ophthalmologists make eye drops? So it's just making a grid, and I'm continually pushing down. And I'm actually you can go, do you have a gauze on these eyes? You can go halfway to the hub, which is 2 millimeters, and those follicles sit between 2 and 4. So anywhere between halfway to the end of the hub. But once you get going, when you get up to speed, when you go fast, and you microneedling, then you're actually going in all the way. So you're down to 4, but you've got that block that it's 4 millimeters, so you're not going to go too far. So I'm doing my last row with this needle. Okay. Then I'm going to swap and show you the fancy one, which is new and obviously covers a lot more ground, a lot faster. So now I'm sort of doing 3 rows at once. So forgive me, Dr. Flax, but some feedback, but now we're doing 3 rows at a time. Still centimeter apart. Okay. 3 rows done. So really, it's so quick and worth it, and you'll make your dinner. Now remember, you've got to picture where they're going to lose hair. So a lot of men will have that triangle. So you're going to do where they want the hair, but also where they would lose behind that. In a crown, they usually lose a halo around the crown. So do the crown and then do the halo. So that's how I do the front, is rows and rows. And then just to get the back, I go along with the crown. So now I'm going to ask you to lift up and, sorry about your neck, and then lean. So I let them lean right down on my hand. And you can carry on the rows, but it's usually quite a clear crown in men. So I'm going to start with a pitchfork. With this one I do a snail pattern. Done. Marvin, I'll carry on with that one. And just to show you, this is how you say sorry. The area that you've done, you wipe away any little bumps, push it all out evenly, and just a gauze, please. Yes. So he's going to have this, another one in a month's time, and another one, and then leave it. You can use either or. So I actually find my patients find the dermapen more painful than this, but it's a very good treatment for hair. So what you'll see, and I don't know if it's showing on the camera, and the reason we use that grid system is apart from the blood, the whole area of skin is pink. So that VEGF, that vascular endothelial growth factor, is already doing its thing. And if you see a white patch, you maybe have missed out your centimeter, but there's a nice uniform pink in front. But I haven't finished my snail at the back, so there's still a whole white area here that we have to do. And for a man, our patient's very brave. I think he's coming on a break. So now I'm just carrying on my snail, and these 3 really make it a lot faster, because I can do the whole snail done in one, and I'm going slightly beyond where the hair loss is just to prevent further. And that's it. Like I said, such an anticlimax. Tomorrow you're all going to do a row of hair because you won't get past my station, and you'll see that it's very, very easy. So now he would go home, not wash his hair for 6 hours, but preferably do it in the afternoon, and then he doesn't wash until tomorrow. And that's it, just another sorry. Do you want to make any announcements about tomorrow?
No. Tomorrow, you guys can show up as early as 8 a.m. We'll be ready to go, and we'll have all the stations ready. And like I said, your job, you're going to pick up sheets to sign. Obviously, it's 7 stations. You got to get through all of them, so it'll be fun. There's a lot of educators there, so have a good evening.